Hello, everyone. We are back and we're talking about medications that we give to patients who have chest pain or acute myocardial infarctions this week. This is no longer just the days of Mona. All right, the first one we're going to talk about is morphine. Morphine is an opioid analgesic that we give for patients with chest pain. It's kind of starting to fall out of favor with patients with chest pain because of its tendency to cause a histamine release. Typically, the dose is 1 to 5 milligrams given IV. Now, traditionally on the ambulance, it comes in 2 milligram vials. So a lot of times we end up giving 2 or 4 milligrams to these patients. But for this exam, the appropriate dose is 1 to 5 milligrams IV. And it does have an immediate onset. And it does have good pain reducing effects. Next medication we're going to talk about, we're kind of ramping it up here a little bit. We're going to talk about fentanyl. Fentanyl is a Schedule II opioid analgesic, also known as Sublimase. It is given in microgram dosages that are usually based on kilograms. A lot of times you'll see people giving 50 mics or micrograms of fentanyl or 100 mics of fentanyl, but the dose that we're going to use for this exam is 1 microgram per kilogram. It is a good pain medication. It has a little bit slower onset than morphine, so you might see people that you prefer morphine, and sometimes that's because of morphine's immediate onset. Next medication we're going to talk about is nitroglycerin. Nitroglycerin can come in many different forms. It's also known as nitrostat, and it can be given several different ways. We do give it sublingually underneath the tongue, but that's not oral. That is sublingual. It is actually soaking in through that mucus tissue that is under the tongue. Very vascular, very thin, allows for good bioavailability to get into the system quickly. Typically, we see patients, their dose for sublingual nitro is 0.3 to 0.4 milligrams per pill or squirt if we're using the spray. Traditionally, the dose is 0.4 milligrams, but for this exam, it is 0.3 to 0.4 milligrams sublingually. But note, be careful if your patient is using their own nitros, because sometimes those patient nitros can be 0.8 milligrams, and as you know, that's the equivalent of 2 of our nitro. So just keep that in mind. If the patient asks, should I take another nitro, make sure that they are the 0.4 milligrams and not the 0.8. If we have to give nitro in the form of a drip, now that's not something we carry on the ambulance traditionally. We typically, that would be for like an intra-facility transfer, and the dose for that in the in the infusion would be a 12.5 to 25 microgram bolus, and then a maintenance strip of 10 micrograms per minute. That would be your traditional dose. And then you might have to titrate that if you're able to, based on local protocols, to keep their blood pressure up, because nitro does have a very vasodilating effect, and that's why we're using it. But it does definitely reduce preload back to the heart, reducing cardiac output. Now, also, one of the big risks with nitro is if a patient is taking medications such as Viagra or Cialis. But we'll talk about that more here in a couple minutes when we talk about them towards the end of the lecture today. Next medication we're going to talk about is aspirin. Aspirin is also known as acetylsalicylic acid. Typically, the dose is 162 to 324 milligrams taken orally, chewed up. Now, some people will take an 81 milligram daily dose of, some people refer to it as a low dose aspirin every day. But typically, when we give it on the ambulance, we're going to give, depending on protocol, 162 to 324 milligrams orally, typically 324 orally. Now, aspirin is a platelet inhibitor. It is an NSAID and it also has some anti-inflammatory effects. It is not a clot buster. What it does is it prevents clots in the vessels from getting worse. We know that sometimes in heart attacks, the platelets will begin to aggregate and come together. And aspirin prevents that aggregation. So while it will not break the clot down because it has nothing to do with fibrin, it will keep the platelets from clumping together further. So while it might not stop a heart attack, it hopefully will stop the heart attack from getting any worse. The last two medications we're going to talk about are not medications that we carry on the ambulance, but they're medications that it's very important that we know if our patient takes them or not, especially with our chest pain patients. We're talking about tadalafil and sildenafil, and those are basically Cialis and Viagra. They are medications that are given for erectile dysfunction traditionally, but these are not medications that are only taken by men. So it might seem a little counterintuitive to ask a woman if she takes Viagra, but it is a very real necessity that you do so. Why, you might ask? Viagra and Cialis were not found for their initial purpose that they're used for now. They were trying to find medications to help with primary pulmonary hypertension. And they noticed that the men were having this consistent side effect. So what it really does, it is a powerful vasodilator, and it promotes blood flow. And when we see it given to people not for erectile dysfunction, we see it given for two things. We see it given for primary pulmonary hypertension and for HAPE prevention. HAPE stands for high altitude pulmonary edema. And when you're at high altitudes, that partial pressure that is in the high altitudes is less than what the body is normal to. So the body can push fluid into the alveoli from the vascular space. And hopefully what that medication will do is vasodilate in the lungs and prevent that fluid from coming out of the vascular system and into the alveoli. There's two different. There's Cialis and then there's Viagra. Cialis is a medication that patients typically take daily, and it allows them to be ready for intercourse if the need arises. Viagra is a little bit different in that it is for the spur of the moment. Now, typically with Cialis, the onset is 30 to 60 minutes, but it can last for 36 hours. And that's a big difference in Viagra, because Viagra, it comes on quicker, and it the effects go away within like 20 minutes or so, to up to 120 minutes. So it's more of a spur of the moment, I need this medication, versus Cialis, which is more, I take it daily, so if the need arises, they're successful. I don't know how else to say it. But what is very important to do, remember this, is that if you are going to give someone nitro, ask them if they take any of these medications. And really, you shouldn't even ask, do you take anything for erectile dysfunction? That would not be the best way to say it, because you wouldn't want to ask a woman if she takes anything for erectile dysfunction. What you can say is, do you take any medication, this specific medications for primary pulmonary hypertension or anything like that? Because that medication, in conjunction with nitro, they potentiate each other, and you can see profound hypotension if those two medications are given in conjunction. So what I can say with this is you need to ask this question. Sometimes it gets kind of forgotten, but the first time that you get burned by having somebody that has profound hypotension because of that, you will have learned your lesson. Like I said, we do not give nitro to patients that take Cialis or Viagra. That's all we have for this one. If you have any questions, please reach out to your instructor. I hope you have a great day.